series of the Nottingham City Place-Based Partnership Share and Learn. I have the pleasure of being joined this afternoon by Mark Sailsbury, who's the Clinical Director for the Bulwell and Top Valley Primary Care Network, and Tracey Tyrrell, who's the Director of Nursing and Allied Health Professionals at Nottingham City Care, and indeed the founder of our Share and Learn programme. So it's good to have Tracey on the other side of the camera today. Mark and Tracey are going to be talking about the community transformation programme that Bulwell and Top Valley PCN has been involved with since the beginning of this year, and talk about the progress that's been made over this really exciting programme. Bulwell and Top Valley is one of a few sites across the Nottinghamshire ICS to be an early adopter for this programme, so we're looking forward to hearing about how they've been getting on. The format today is the usual one, so about a 20-minute presentation from Mark and Tracey, and then we'll have 10 minutes for questions at the end. So make sure as they're presenting, you pop your questions in, and you can do that by going up to the Q&A box at the top of your screen, popping your question in, and then we'll post it, and then we'll pose it to them at the end. So without further ado, I think I'm going to hand over to Mark first to kick us off. So over to you, Mark.
Okay, good afternoon, everyone. So I'm Mark Sailsbury. As Rich has introduced, I'm the Clinical Director of Bulwell and Top Valley PCN, and I'm a GP at Rise Park Surgery. So Tracey is actually going to do most of the talking about the actual community transformation programme itself, but I'm just going to give you a little bit of background and an overview about Bulwell and Top Valley leading up to this programme, and just some of our journey up to the point of starting this programme. So Maisie, if we could just have the next slide. So I'm sure most of you are aware of where Bulwell and Top Valley is, but essentially our PCN is covering the most northern patch of the city. So we cover Bulwell, Rise Park, Top Valley and Bestwood. And next slide, please, Maisie. So I think when we think about deprivation in the city, I think often we think about the inner city as being an area, but actually Nottingham North, which includes all of our PCN and then Bilborough as well, is the 10th most deprived area in the UK. And so actually of all the areas and the government constituencies in Nottingham, we're the most deprived area of the city. And then we look when bringing things down to smaller patches within the city. Bulwell Central is the most deprived area within the whole of Nottingham City as well. What's different, I think, with our area is that we are less diverse in terms of ethnicity than a lot of the other areas of the city. So our key challenge within Bulwell and Top Valley is about poor health outcomes in our poorer white British population. And one of the key figures that we come back to over and over again is that within Bulwell and Top Valley, healthy life expectancy is only 57 or 58 years. And that really will compare to other areas within the county, like Rushcliffe, where people's healthy life expectancy is more like 73 or 74. And we really feel that 15-year difference is unacceptable for our population. Next slide. So as a result of this, obviously at the beginning of PCN's, most of our time was diverted with the COVID effort, but a real key focus of setting up primary care networks was about actually looking at the entire community provision and not just about general practice within there. So actually we sort of really felt in Bulwell and Top Valley to try and kickstart things in early 2021 with some support from the city ICP as it was then, and Tracey came in at that point as a deputy clinical director for the ICP to give us some support in really starting to get this process going of actually bringing together all of the key players within Bulwell and Top Valley. And out of that we formed the Bulwell and Top Valley Health Forum. And we have this strap line that we have there, which maybe is a bit of a bold statement that we make, but we say that the Bulwell and Top Valley Health Forum is the driving force for improving health and well-being of the population of Bulwell and Top Valley. And that's really the aim of bringing this group together. So we've had a wide range of stakeholders right from the beginning in July 21 when we first met that have engaged with that. So we've got the primary care and PCN involvement, but community health and care providers, including city care and other providers. The council services have really engaged, along with secondary care, including mental health services. But we've also then had involvement from schools, community pharmacy, lots and lots of involvement from the voluntary sector. Our councillors have got involved, our MP has been involved, and then housing services, Department of Works and Pensions, and patient representatives. So it's been a really good body of people that have come in and have been really engaged from the start, and there's been a real enthusiasm of that group to come and look at things together, to actually look at how we can work well together, and really we feel that with that the PCN is the facilitator of that group, but we're not directing that group. We're really allowing it to be an organic sort of group of bringing people together to talk about what's important to them. So next slide, Maisie. So one of the things at the first meeting that we had with all of these people together, we said, what are your health priorities for Bulwell and Top Valley? So if we move on to the next slide, it actually zooms into that a little bit more, so we can see the things that they came up with. But there was, sort of a lot of key issues in there. Mental health came up as the big central focus, but in things, healthy lifestyle, so we've got obesity, alcohol, physical inactivity, lots of issues to do with children and young people in there, but also other issues about workload for the agencies working within there as well. If we go to the next slide, so out of that we looked at establishing co-production with the members of the Health Forum. And so we developed 3 working groups really out of those priorities that were set. So we've got a working group for healthy lifestyles. We have a working group looking at childhood vaccinations particularly, but really trying to bring together everybody who's working within that sort of children and young people sphere within the area. So vaccinations are our focus at the moment, but hopefully that group will then be able to move on to other things in the future. And then we're bringing together the relevant parties for mental health and really looking at what the problems are in our area, how we can work together. But a good tester for that was actually with COVID vaccinations at the end of last year. So the Health Forum was very early in its formation, but we came up with quite a relatively innovative collaboration between the PCN and the community pharmacy working together in the delivery of COVID vaccinations. But with that, we were able to engage our Health Forum partners to come in who help shape the service, but also helping us with patient engagement, helping us with vaccine uptake. So within our weekly meetings for the vaccinations, we had the councillors coming in, we had the various voluntary sector agencies, we had the people from City Care coming in, all looking at how they could help with that COVID vaccine. And it helped us with this establishing principles of working together and co-production within Bulwell and Top Valley. So if we'd move to the next slide. So out of that came the question, what next? We'd really established strong relationships within our health and care community in Bulwell and Top Valley, and there was a really good appetite from people about working together and looking how we could work together more effectively. And this is where the opportunity came towards the end of last year of the Community Care Transformation Programme for early adopters. And this just felt like a real natural fit for us to be looking at our wider services, how we provide care within our area. And so we jumped on the opportunity for this. And this is where Tracey will take over and tell you more about the programme itself.
Good afternoon, everybody. I'm Tracey, Tyrrell, Director of Nursing and Allied Health Professionals for City Care, and working closely with Mark and colleagues around, obviously, the Community Transformation Programme. So just really to put it into context, obviously this approach came as part of the integrated care system. And what this diagram does is really show you the direction of travel that's been taken. So I've actually been part of this work for the ICS, and started off with the programme director Becky Sutton, doing a range of engagement with a range of partners across, obviously, the ICS. So really hearing about what did people feel community services were, and what did people, more importantly, see as good. And then obviously really working through this into thinking about how we actually then came together with a blueprint of what that would look like and what we actually wanted to define and to resolve, and then moving into a 100-day cycle. So next slide, please, Maisie. So this is where we come to with what does good look like. So obviously this came out from a range of engagement events that we did. with a range of partners and people from across our system. And so these are the building blocks. So that focus on health and well-being, improving the experience and outcomes for our citizens, really having that underpinned by a happy and healthy workforce so they could really provide that good care, good communication, working obviously in true partnership with our communities, and then delivering a really integrated care offer. So next slide, please. So for us, our journey, as Mark says, we felt that we were ready to apply and become that early adopter site, and we were successful in that application, and we're one of 3. We internally had conversations about how we were going to steer this work, because obviously what we didn't want to do was start something and then not see that it would flourish to its full potential. So for us, we set up a senior project group, and that would report both to the Health Forum, but also obviously to that programme board at ICS level. So making sure that we really maximised our potential and our outcomes. We obviously recognised that we needed to have some senior executive director sponsors, and myself and Mark and other colleagues put ourselves forward. And I'm going to talk a little bit more about our approach in the Local Design Council, but we established that on a 100-day cycle of improvement. And currently where we are is that we're undergoing our engagement activity. So next slide, please, Maisie. So the 100-day cycle really is done very much on an act, plan, study and do delivery model. So next slide, please. But what's really important is that this is a group of people who come together as equal partners. So irrespective of where they work, which organisation they work for, they come together with our people across Bulwell and Top Valley. We've got a wide range of people, and what we're really seeing is that collaborative integrated workforce building up. Population health management is pivotal. And we've really looked at our existing community assets and then how do we build from that. So next slide, please. So this is the journey. So really coming together in that 100-day cycle, obviously really thinking about our citizen engagement, thinking about what our current story is, and if we put those building blocks in place, what our future story would look like from that person-centred approach. Making sure that data is pivotal, so really understanding what the health inequalities are and where we want to be, and then really starting to think very differently. So rather than the traditional methods, thinking wider outside, and then really thinking about some of those enablers. Next slide, please. So for us, out of those 2 building blocks, we felt as a group, as a true co-production group, we wanted to focus on health and well-being and that happy and healthy workforce. Next slide, please. So you can see that under that focus on health and well-being, there are a number of principles, and in our 100 days, we have chosen to focus in the first stage of our improvement journey on health literacy. So what can a person and community do for themselves? Obviously, as we move forward, we will commit to looking at the other areas, but this is our main focus at the moment. Next slide. And in our journey, what we've done is we've reviewed our data, but we've also then looked at a SWOT analysis. So really looking at strengths, weaknesses, opportunities and threats. And I appreciate this is a really busy slide. But for us, what's really important is that we thought about, as a partnership, what strengths did we have? So we could see that we'd got some shared visions, shared aspiration. We could see that some of our weaknesses were around perhaps some of our expectations. So what do we believe as health, social care professionals, voluntary professionals, that the services that we provide, what do our people receiving those services expect? We saw that we'd got huge opportunities about looking at how we could train together, how we could recruit together, how we could really enable some of our residents in our local populations to be those community health champions, and really thinking in that patient story about what the future could look like for a person living in Bulwell and Top Valley. And then really importantly, we reviewed our threat. So thinking about things like our policies, procedures, how we work together, how our individuals working in the local area can feel safe to hand back care to the patient or person, and thinking about time and opportunity. Next slide, please. So then looking at a healthy and happy workforce, again, there was a number of building blocks, but we chose the circled one, which is recruitment and retention. So really thinking for us pivotal about that to provide what we really wanted to and to make the difference, that actually we're nothing without our people. In whatever organisation they are working with. So really thinking about how we could work together, how we could recruit together in our local area, and how we could then more importantly retain. Next slide, please. So again, we undertook that strengths, weaknesses, opportunities, threats mapping, and really thought about some of the strengths. Actually understanding each other, having time to build up through that local design council to build up knowledge about each other so that we really understood what service offer was out there. Thinking about funding opportunities where we could come together. And then weaknesses, really thinking about some of the pressures that we currently face as all partners in a system. So we know that obviously recruitment of the high calibre and retention, it can be really problematic at the moment. But then more importantly, starting to think about opportunities. So actually, could we train together? Could we recruit under policies, procedures together? Could we do things very differently? And then again, exploring some of the threats around us. So thinking about turnover, learning lessons from work that's already happening in the local area, and then thinking also about some of our voluntary partners, such as volunteering fatigue. So next slide, please. So where are we now? Well, we've reviewed that population health data, we've done that mapping out exercise, we've chosen our 2 priorities, and we're about now ready to go out with a co-designed set of questions, and we're doing that both in person and through electronic survey to really ask in a true co-productive way our population what they feel. So for instance, to give you an example, one of our district nurses in Bulwell and Top Valley is going out to a range of patients who's on our caseload, asking some particular questions around health literacy. So what does it mean to that individual? What would their shift, what would they like to see for now and in the future? And likewise in recruitment and retention, we've got one of our voluntary organisations going out to our young people through volunteering, going out into areas where children and young people come together to ask them about what would a career look like in health and social care, what would make them apply for a post, what would some of their future career aspiration be. Next slide, please, Maisie. So for us on our journey, obviously for us now, once we've done that co-production and got the real sort of hard evidence, those themes will lead us then to taking improvement action. So that's where we are in our journey. We absolutely believe that this work will allow us to really test and learn new concepts. And we're already starting to talk about whether there are things contractually that we can do that will maximise some of those opportunities. But clearly we want to do that in the right way. We can already see that we've got that collaborative partnership. So we're having conversations and discussions through our work that we wouldn't have had before. We're learning about each other. We've got mutual respect, honesty and trust building up. And we absolutely believe that this will be a real platform for us to catalyst into those improvement actions. We can see system leadership. We can see people coming forward as natural leaders. and it's great to see them. We've got a really enthused, energetic group that's really great to be part of, and we can see true co-production. And most importantly, obviously, our ultimate goal is to really make that difference for the population and the people that we serve. So thank you. And we're open now to really looking forward to your questions and any reflections that you have about our programme of work.
Thank you very much, Tracey and Mark. Really wide-ranging programme, and Tracey, you mentioned the word learn quite a lot of times throughout that presentation. It feels like you have been on a real journey, a real learning journey throughout this, and it's great for you to be able to share that with us. We've got a question to kick off here from Sean, which says, how have you engaged with the public in your design team? And it says, there's a comment really, it says, generally this is a bit of an ongoing challenge.
Okay, so if I start off and then Mark can come in. So absolutely, true engagement is really important to us. So on our local design council, we absolutely have people who are living and residing in Bulwell and Top Valley. However, what we have realised is that we can't expect people to come to us. And if we want to get true engagement, we need to go out to local area. So in the piece of work that I've just described, we are going out to a variety of settings. We're using our social prescribing colleagues and also some of our charity and volunteering colleagues to go out into those local areas. So we're going out to schools, and we're going out to market, the Bulwell and Top Valley market area. We're going out to some of our friendship, leisure type arrangements so that we can really truly engage with a wide variety of people who perhaps wouldn't normally come forward to a formal meeting and structure. So I'll let Mark come in.
Yeah, so I think very similar to as Tracey has said, it is difficult in terms of engaging with a proper wide range of the public. We found that as a PCN in previous work that we have done. With this, we do have citizen representatives within the Design Council, but actually they themselves are very clear in saying they don't feel that they fully represent our community. You know, there's a particular sort of person that likes to get involved in these things, and they know that they're not representative. So I think a key thing for us has been that we've got this very broad range of partners through the Health Forum in terms of lots of links with lots of activities that are happening and services that are happening. So we've got people on the ground who are actually meeting people, and we can't expect people to come to us. So it's very much about us going to them. And we went to our Health Forum and said to them, you know, we're going to be doing this engagement. Where should we be going? Who can we go? Who have you got links with? And they came back with, you know, dozens of answers of places and things that they were involved with where actually we could engage with the public. And now we're going back to them and saying, here's the questions we want you to be asking these people, you know, get on with it for us. And because we've built that network of partners, we've got the resource there where we can just get that reach out when the time comes for engagement.
Thanks both, that's really, really interesting. Next question. So this programme I think has been going on since about the beginning of the year. And so yeah, clearly a lot's happened in these sort of 10 months, but I'm just keen on your reflections as to how you've got on over these last 10 months, and I guess where you're up to compared to where you thought you might be up to at the start of this programme.
Should I go first with this one? Yeah. So yes, I think it's when we think about that, this has been going on since the beginning of the year. So I think it was around February time that we were confirmed that we had been sort of chosen as one of the early adopter sites. And obviously there was quite a bit of preliminary work with that before we really then sort of went live in terms of forming the local design group, which was probably around June, July time that really were in that sort of formation. And in our preliminary work where we were together as the sponsors, as PCN, City Care, other partners, I think our expectation with this was that it was going to be very fast. It was going to be intensive. 100 days was a short time. We'd be packing a lot in. And I think also our view was probably that this was very much going to be about service design. It was going to be looking at the way we do things. our experience is that as we've now brought people together, that actually the process has been much slower, actually, because it's been about getting that level of understanding from each other, and it's not about action, and it's all about actually just finding out what people's concerns are, what people's priorities are, and then looking at how we can shape things in the future. So for us, in terms of what we're working on now, it's very much foundational things about improving our population's understanding of health, so that then we've got good foundations in place, and then also looking at making sure that we have got a good foundations so that we've got people to be able to provide those services. But actually the talk about the services themselves, which we anticipated, that has not been our experience at all.
Thanks, Mark. And yeah, I'd echo all of that. I think as well, what we've seen is really strong, effective relationships building up, and a real mutual trust and understanding, which will now allow us to really understand once we get that feedback, so that we can really take forward those actions, those improvement actions. And I think that we probably hadn't anticipated that, that actually that relationship, that culture is so critical to us. I think the other thing for me as well that's really important, and I think Mark's already said this in the presentation, but is around that health population data. So actually we've used that data so that we've all come through that local design council up to the same level of understanding about actually what is it that we're trying to improve for Bulwell and Top Valley, and really listen to not only seeing the data, but also listen to what people feel are some of the opportunities there and the strengths, but also understanding some of their weakness and threats. So I think this next phase of work is going to be really interesting for us, this consultation that's happening now, to gather that all together and then to turn that into those improvement actions. And I think we've got a great group who are really empowered and have got a really good working relationship to now take forward those improvement actions.
Thanks both. Some really helpful reflections there on partnership working, and I guess just what it takes when you've got, you know, a team, I guess the size that you do, and from all the different organisations that are represented, you know, the time taken to get things right. And I guess just wanting to tap into your learning there as well, and thinking about other people who are undertaking these sorts of programs, and as leaders, what advice would you give to people undertaking these sort of large scale transformation programs? Perhaps we come to Mark first and then to Tracey. Sorry, Mark.
Oh, thank you. I think I think we keep coming back to relationships, don't we? But I think that's the key thing for us. I think we, you know, coming into this community transformation program and that sort of fairly rapid 100-day cycle where we're expecting a commitment from people to be sort of meeting up every fortnight, we thought weekly was probably too much. So, but people meeting together every fortnight, actually that was based on the fact that we'd already got a committed group of people that had come together and had said, yeah, we're really enthusiastic about improving the landscape in Bulwell and Top Valley, and we want to be involved. And I think it would have been really difficult for us to have done that if we were coming from complete cold and trying to engage these people in there. So I think it's very much about building relationships between the partners, but not just the partners. It's all of our voluntary sector colleagues that, you know, they are really key, and they have such insight that we don't have as health and care professionals, because they just bring a completely different perspective into things. And also, you know, local council, the councillors are so engaged and so keen, and I don't think I'd ever appreciated that before, that they really want to be involved in here, and they've got so many contacts, so many links, that really make life much more straightforward for us, because we can actually tap into them.
Thanks, Mark. I'd probably, the other only area I'd add, and I agree with everything Mark said, is probably just about leadership and time. So giving yourself the time and having, I think for us, something that's been pivotal is having that checkpoint, that senior sponsor group. So we've got a group of committed people to come together as well, just to give that strategic oversight, and I think that's really important. And obviously for us, we've obviously got that dedicated resource at the moment from the ICS group, but clearly for us this is about a sustainable long-term programme of work. So we wanted as a group of individuals to make sure that whatever we built today would continue to be that improvement journey. And I think also just in allowing and enabling those leaders in your system, in your local area, and I think we're seeing that now through our local design council. And when I say leaders, I mean leaders at every level of leadership. So we're seeing some of our people who reside in Bulwell Top Valley really finding their voice now, and being able to lead some of that conversation, and others, and some of our other key people who are working in our local area, perhaps at a more junior level, but are absolute leaders. And so really giving them that opportunity and space to be leaders, so that we create something that will really change and make a difference.
That's brilliant. Thank you very much, both of you. Right, we've come to 5:30 now, so we've just about run out of time. But I want to thank you, Mark and Tracey, for sharing your learning for the programme this afternoon, and thank you everybody also for posting your questions to Tracey and Mark. This is the final one of our share and learns in this series, but we are busy cooking up the next series, so keep an eye out for that. But until then, have a good rest of your day. Thanks.